Hi, and welcome to this episode of Healing Our Communities. I'm your host, Dr. Susan Margaret Murphy. I'm president of the West Virginia Drug Intervention Institute, and we have a special guest here with us today, Emily Ferry, who is one of our outreach and education coordinators, and she works specifically with our grant through the Appalachian Regional Commission. So welcome, Emily. Thanks for being here.
Thank you so much for having me. It's really a pleasure to be here.
We're so excited to be talking to you today.
Oh, well, thank you. It's great.
We're going to talk a little bit about your background,
Okay.
but also want to share with our viewers a little bit about the Appalachian Regional Commission grant. And so I'll just start by saying that we were fortunate enough at the Institute to be able to hire 7 part-time, I think there's actually 8 of you now that I say that, 8 part-time people. And part-time's kind of a misnomer because you're working about 30 hours a week.
Yes.
And you're in counties throughout southeastern West Virginia and Kentucky, which we'll talk a little bit more about in a moment. And you're working with law enforcement, but you're also working on overdose response and education, as well as with local police departments. So we're super excited to have you here. And we really, really want to get to know you first. So we'll do the first part of our segment on all things about Emily. So we'll keep it as painless as possible, but wanted to give you an opportunity to share with our viewers a little bit about you outside of the work you do. What's your background?
Okay. I have first of all, I'm a mother of 2. So I have 2 beautiful kids, 12 and 11 now, so it's happening so fast. Mm-hmm. I grew up in Charleston, West Virginia, was born and raised here, so deep community roots. My family is from here. I love being outdoors, just any kind of downtime. I'm good with finding a good show to stream and getting locked in. Background as far as education-wise, I have an associate's degree in human services, rehabilitation studies from Bridge Valley with a specialization in addiction and psych rehab.
Wow.
So, and I'm currently working on my bachelor's in social work at State.
That's fantastic. That's really good to hear. I'm not sure I knew all of that, so that's fantastic to hear, and certainly know a lot about Bridge Valley as well as State, so you're in great places.
Yes.
Good
and
programs.
Yeah, absolutely, especially with the recovery programs on campus now, too.
Yeah, so. That's fantastic. So your position at the Institute is really working with the ARC grant as an outreach and education coordinator. Can you talk a little bit more about the grant that you're working on and maybe how your other colleagues are also working on it in their communities? Because there's some similarities.
Yeah, absolutely. The grant we're working on is the ARC grant, Appalachian Regional Commission grant, and it's throughout 15 high risk of overdose and substance use throughout counties throughout West Virginia and Kentucky. And really there's two main things that we focus on the grant focuses on. And the first thing is employing people in recovery, which is important. So people like me in long-term recovery who wouldn't normally have the ability to have this kind of position are being employed, which is always fantastic. And the other thing is providing resources for people in recovery in our own communities. So whether that's working with the police department or delivering one boxes, which we've been so fortunate to have, and attending meetings and just being there for people, providing test strips. So a lot of prevention work. So it's a really great program.
So you're really working on the prevention of people needing the services on the other end in terms of the recovery services, but we're also working to get people who are in active use into recovery, which is it's hard work. but it's fantastic work. And one of the things that I will say as the president of the Institute is, there's a lot of organizations and businesses out there that I think are hesitant to hire persons in recovery. And I was at a roundtable meeting with some folks from Jobs and Hope, and this was being discussed. And I said, hiring people in recovery is no different than hiring any other employee, right?
Right.
We should all have compassion and help, all of our employees meet their needs and responsibilities. And so to me, it's been a true joy to have individuals like you who are in recovery to help inform the work that we do. There's a saying, nothing about us without us.
Right.
And so having those of you who are in recovery to share your perspectives, I think is invaluable to any organization. So I'm just thrilled to have you and others on. Can you talk a little bit more about your specific role at the Institute and the opportunities that you've been given as a part of that role?
Oh, I've been given great opportunities. We've had some great trainings that I've been able to be a part of that I wouldn't normally be able to. Just being able to assist people who are looking to get into recovery with those resources, and also providing one boxes has been really great because it helps people, with overdose, and that is just such a rewarding thing to me. But there's been countless opportunities. I've been at several different events that I wouldn't normally be able to. And like I said, it's been a great experience all around. But as far as my role individually, whether I've been able to spend some time in the office recently in downtown Charleston, and I've loved that. And that itself is an opportunity. But I just feel really fortunate to be in the position I am.
And you actually did some naloxone training at Overdose Awareness Day in
Yes.
August, and also at Healing Appalachia.
Yes.
So you've actually been on the front lines in the community doing some of that work.
Yeah.
Which I think is crucial because, we've all talked about in the office, the more people we can train on how to use naloxone and respond to an overdose, the more we can reduce the stigma about overdose and responding to overdose, and the more we can create that community of bystanders.
Absolutely.
And your county is Kanawha County?
Yes.
That's your only county because it's so big, right?
Yes.
And some of you have upwards of 3 counties.
Right.
But those counties are a little small.
Little smaller.
Yeah. So
Kanawha County has been great for me, just because, like I said, I grew up here and I already had some community roots, and especially within the recovery community. So being able to train people on naloxone or passing out fentanyl test strips or xylazine test strips, it's been great to see the impact that has on our community. And I think we're starting to see, just what can be done if we band together and take these steps, because West Virginia has been hit so hard by this epidemic, and we have to hit right back just as hard.
yeah,
So,
it has to be that coordinated effort.
absolutely.
So I'm going to throw in a question that's not here, and I don't mean to scare you or panic you by throwing it in. But what do you think, just in the time that you've been in this work, is the most difficult thing about getting people connected to recovery resources? What's been the biggest challenge in that regard, do you think?
The biggest challenge has definitely been stigma. The stigma that surrounds recovery and admitting that you have an addiction problem, the mental health stigma, even the stigma people feel when they go to do things like train people who aren't in recovery. So when they go to train for naloxone or pick up test strips for people they love, the stigma there has been something that it's been a challenge to overcome. And, that's part of our job in this grant is to reduce stigma. So we're working at it.
And then you also have stigma in terms of what pathways to recovery people choose, whether that's abstinence-based 12-step kind of model, whether they choose to do medically assisted treatment. There's some stigma around what's the best pathway. And of course, we at the Institute support all pathways to recovery
Right.
because every person is different, right?
Yes, and we know that recovery is not linear, so we know that just like all of our stories are different, all of us got into drugs or substances in one way or another, we're going to find our own way to recover. So it might not match up the person beside you, but you have to, commend their effort either way.
That's right. It's like any other disease state, right? So
Yes.
if I have diabetes and you have diabetes, we may manage it completely differently.
Yes.
And the same thing, I also think a lot about mental health and depression,
Yes.
and how some people need to be on an antidepressant just for a couple months to get them through maybe a depressive episode, whereas other people might have to be on an antidepressant or an anxiety-reducing medication for the rest of their lives.
Yeah.
And then it's the same thing with recovery.
That's such a good way to look at it because, there's so many different ways, and each way is different, just like a person is different. There's these co-occurring disorders. Some people that are in active addiction might have depression problems in their family, and they might have been depressed before. That might have even been the reason they decided to use. Another person, maybe that wasn't involved, So the recovery is the same way, I believe. There's so many different paths, and the stigma that surrounds them, it really prevents a lot of people from being able to recover.
And even asking for help.
Asking for help or admitting they have a problem.
Yeah.
Yeah.
Well, it's good that in these communities, in these counties that we're targeting, that we know that there are you all and others in those communities that are trying to be the safe space for people to come and ask for help. So that's fantastic.
Thank you. Yeah.
That's great. So what would you tell someone who wants to get involved with the type of work that we do at the Institute? What advice would you give them?
I would give them the advice that there's just like we were talking about the many different paths to recovery. There's always people looking for volunteers at first. So if you're unsure about it or you don't know a lot about it, you can always volunteer. There's plenty of different organizations. The Institute is a great one. Jobs and Hope is another place that you can really start to look. And I would just tell them to keep an open mind, because a closed mind can really hurt a lot of people that are trying to recover. So I would tell them to keep an open mind and try volunteering to see if it's for them. And then there's many paths. You can go to school, or you can train to be like a PRSS. There's a lot of different trainings and a lot of different positions, and we're always looking for people to stand on those front lines with us and really make an impact in our community. So.
Yeah, and for our viewers, PRSS is Peer Recovery Support Specialist.
Yes.
And those are individuals who are in recovery, in long-term recovery.
Yes.
But often they serve as coaches and guides to those persons who may be in active addiction or maybe just getting into recovery.
Yes.
And so it's that peer-to-peer relationship. That's talking to somebody who's had that experience before that I think really makes the difference for that person.
It does, because you've been where they are, or you've been somewhere close to where they are, You have a lot more compassion. I know I had a peer recovery support specialist at Bridge Valley where I was attending school, and they made a great impact in my early recovery. Just having the advice of somebody who's been there. And, you know, also at the end of my addiction, I was, or my active addiction, I was feeling very hopeless. So being able to look at somebody and see hope and see that they're able to have, you know, they were once where I am, and
Yes, yeah.
they're able to recover their life, whether that means just getting a job or having their home or their children. You know, all of these things are important. So inspiring hope really makes a huge impact.
I love that, inspiring hope.
Yes.
We're going to take a short break and we'll be back with more from Emily Ferry.
Hey, Grandma Peg, what you doing?
Oh, hi, Rex. Well, you remember little Maddie, right? My granddaughter? She's on her way over to spend the afternoon with me.
What about these medicine bottles and pills, Grandma Peg? Those could be really dangerous with sweet little Maddie around. You remember what to do, right?
Oh, of course I do, Rex. I was just getting ready to put these away.
Don't keep old Rex around.
Hi, and welcome back to Healing Our Communities. I'm Dr. Susan Margaret Murphy, president of the West Virginia Drug Intervention Institute, and we're here today with one of our staff members, Education and Outreach Coordinator, Emily Ferry. So welcome back, Emily. We're ready to start on our second round.
Let's do it.
Let's do it. So we are learning a little bit more about you. We've talked a little bit about the ARC grant. I want to delve a little bit deeper into your recovery and your experiences with it. So can you talk about how those experiences have informed the work? And as a person in long-term recovery, can you share a little bit more about your story?
Okay. First, I'll share a little bit more about my story. I, like many people in West Virginia and across our nation, had pain problems and went to a doctor. I had family members who had experienced addiction, and I thought, nope, not me, never, I'm untouchable. And I also thought, well, it's given to me by a doctor. It's certainly safe. I'm good to go. So that's really where my addiction started. And then my tolerance grew and grew. And about the same time that my doctor stopped writing me pain medication, I started searching the streets for it because I was getting sick. So that eventually turned into heroin, which turned into IV drug use. And I'm a person who has overdosed multiple times. And beyond that, one of the reasons and one of the things that really inspires my work and touches me is I actually lost my sister to an overdose while we were using together. So it's something that I'm passionate about because I know what those overdoses are like, and I know what it's like to lose somebody, just like many of us have. You know, if it's pretty likely that if you're in West Virginia, you've lost somebody or you know somebody struggling. So also the day that we lost her, she had said, you know, if we're gonna be messing around with this stuff, we might want to look at getting some of the reversal naloxone.
Yeah.
And that same day, we lost her. So
Heartbreaking.
yeah, and I continued to use after that, just covering up pain. But eventually I just got to where, like I said earlier, I was completely hopeless. I was a wreck, and I wanted to get into recovery, but I didn't think that I would ever be able to lead a normal life.
Right.
So that has inspired my work in a lot of ways, because I do feel passionately about it, about naloxone especially. And it's one of the reasons why the one box I think is just fantastic. And so to be able to place those throughout our community, it really does make an impact. And also, it's taught me to be more compassionate. And also, I remember what it was like, you know. It's something that if you've ever experienced it, you never forget it, you know. So it's made me extremely passionate about the work that I do, and it's made me appreciate every day that I wake up that I'm not chained to a substance.
Well, certainly very hard to lose a family member.
Yeah.
And a sibling in particular. So
Yeah.
thank you for sharing that story.
Oh,
I
of
know it probably
course.
wasn't easy to share it. I want to talk a little bit about what has surprised you about your work, what has excited you about your work, but then what maybe things kind of disappoint you.
What has surprised me the most about my work is probably how many people share the same story or a similar story. You know, in early recovery, I thought, well, nobody has had this type of experience. And after talking to people and being able to work with them through their recovery, I've learned that I'm not alone, which is a great feeling. You know, it's not great to think how many people are suffering in active addiction, but it's a great feeling to know that you have people, even if you don't have your blood relatives and family, you have your recovery family.
Yes.
And that has really surprised me, how clutch they come in, and how, you know, when you need somebody and you make a call, they're there because they know what it's,
Yes.
they know, you know, how quickly you can either, you know, overdose, or you can make the same decision to go into a residential treatment, and if you wait a day for that person to go, they're not ready anymore.
Yeah.
So that's definitely something that has surprised me. What has excited me is definitely seeing all the people who have been able to recover and rebuild their life after active addiction.
Yeah.
And that hope that I keep talking about, just having the hope that you can have a life and you can enjoy your life. What's disappointed me has to be stigma, the stigma that surrounds everything. Because so many people, unfortunately, don't get the treatment that they need because of stigma, you know, whether it comes from them or their family. I know people who have had to go to different counties completely to go into any kind of treatment because they're terrified their neighbors or their family will find
That fear's
out.
there.
Yeah.
Yeah, that's
So-
really hard. That's really hard. We only have a few more minutes, so I think I'd like to close really with you answering this question, which is, what is it about your role or working in this particular field in general inspires you and keeps you optimistic for the future? Because we've talked about before on this program that this is very hard work to do. You know, there's usually not a day goes by that we don't hear of someone overdosing. And I had shared in previous, it was the stories I heard about people being saved with naloxone and with the one box that were able to help keep me going. What keeps you going? What inspires you to stay in this field and do more?
That keeps me going, as well as knowing that there are people out there who need assistance and need treatment, and sometimes you are the only person they can reach, or the only person who relates or that can understand. So those are all things that keep me going and keep me invested in this field.
Is there anything else you would want our viewers to know about you or about the work you're doing with the Institute?
I would want them to know to reach out to somebody in recovery if you need assistance, or if you just need to talk, or you're curious about your options. I would also like them to know that there is life afterwards. And for the people who aren't in recovery, I would like to say, you know, that don't give up on the people who you love that are in active addiction. They're still in there somewhere.
Yeah.
And they can get their life back. And the best thing you can do is educate them and be supportive. And also, we will be having Save a Life Day on September the 26th down at the Institute, where we'll be doing naloxone trainings, as well as giving fentanyl test strips and xylazine test strips. And you can also get any of this information. I'm going to do a plug here.
Sure.
Any of this information at www.wvdii.org.
And we may have, by the time this episode airs, have already done Save a Life Day.
Oh, yeah.
So I think it's important for people to know that we do naloxone training ongoing.
Yep.
We'll also be having a drug take-back day the end of October. That's another opportunity to get naloxone trained. Certainly, if you want to learn about the one box or put the one box in your place of employment, which has a video inside the box that can train your staff on how to use
Yes.
naloxone, put it in your recovery center, your church. And Emily's email is emily@wvdii.org if you want to contact her directly. And of course, our office number is 681-205-2287. Emily, I want to thank you very much for joining us
Thank
today.
you.
It's been a pleasure to have you on the show. Hopefully everybody learned a little bit more about recovery and the important role you play. Thank
Thank
you.
you.